Assalamualaikum, this is Vajihamateen, roll number EP1770176, Group 8. My topic of presentation. In this presentation, I will be covering the topics include introduction, virology, epidemiology, HCV life cycle, stages of hepatitis C, symptoms, transmission, diagnosis, treatment, contraindication, prevention, and clinical case study. Now, what is hepatitis? It is composed of two main words, which are hepat means liver and itis means inflammation. So it means that it is an inflammation of liver. Now, what is hepatitis C? It is an infection of liver caused by hepatitis C virus. It is a leading indication for liver transplantation in the world. During initial infection, people often have mild or no symptoms, but it persists in liver about 75-85% in initial infection. Early on, chronic infection typically has no symptoms over many years, or it often leads to viral disease and occasionally serious. Now comes to the virology of hepatitis C virus. It belongs to family Flaviviridae and the genus Hepatitis virus. It is an infectious, blood-borne, enveloped, single-stranded RNA virus with positive polarity. It is a spherical-shaped 50 nanometer in diameter, packaged by core protein and enveloped by a lipid layer containing two viral glycoproteins like 1 and 2 to form virions. A virion is a complete infected form of a virus outside the host cell with a core of RNA encapsulated. It is produces in an infected individual each day up to 10 exponent 11. So, what is the half-life of virus particles? Virus particles is around 2 years and may be as short as 45 minutes. In addition to replication in the liver, the virus can multiply in lymphocytes also. So, there are major genotypes of HCV which are further divided into subtypes as shown in the following figure. Now come to the topic or slide which showing the proteins, structural proteins and non-structural proteins of RNA virus. Now, what is epidemiology of HCV? In the US, about 70% of cases are caused by genotype 1, 20% by 2 and 1% by other genotypes. And if we talk about the worldwide epidemiology, genotype 1 is the most prevalent worldwide and subsequent genotypes. This is the graph which shows the subtypes prevalence of HCV subgenotypes. Now, what is the hepatitis C life cycle? So for production of infection, there is a major or compulsory step which is attachment and entry. In order to enter host cell, the virus must first bind to a receptor on the cell surface. Specific interaction between host cell receptors and the viral attachment proteins takes place. After that, HCV loses the envelope and the genome is released in the cytoplasm. This step is called as uncoating. After that, mRNA is translated. The translation product is large precursor proteins that is processed by cellular and viral proteases into mature structural and non-structural proteins. This stage or step is called as translation because in this mRNA is translated. After that, RNA replication, it starts with synthesis of complementary negative strand RNA using the genome as template, after which genomic positive strand RNA is produced from a negative strand RNA template. Both steps are catalyzed by RNA polymerase. After that, viral assembly takes place. The mature virions consist of nucleocapsid and outer envelope consist of the lipid membrane and envelope proteins. After that, maturation takes place. At this stage, they become matured and ready to release, and after that, they will be released from host cell by secretory pathway. After that, I will be discussing about stages of hepatitis C. Now, if we talk about stages, so first is incubation period. This is the time between first exposure to the start of disease. It can last from 14 to 18 days, but the average is 45. After that, after the incubation period, which is the first exposure, after that the disease which will be start is called as acute hepatitis. This is short-term illness that lasts for 6 months after the infection, after the virus enters your body. In some people, they get rid of or clear by their own. If it progresses for about or longer than 6 months, the condition is called as chronic hepatitis C. It will be a long-lasting stage that is longer than 6 months, can lead to serious health problems like liver cancer and cirrhosis. After that, it will progresses. If it will progresses, the condition called cirrhosis. It is scarring of a liver tissue or cells. It usually takes about 20 to 30 years for happen, though it can be faster if it drink alcohol or have HIV. After that, the cancer progress. After if it progress, though, it leads to cancer. This is the stages showing. Now, what are the symptoms of hepatitis? Many people with hepatitis C have no symptoms, but between 2 weeks and 6 months after the virus enters your bloodstream, you can notice weakness, joint pain, dark urine, diarrhea, anxieties, head pain, hives, diarrhea, fever, low appetite, jaundice, and vomiting. Symptoms usually last for 2 to 12 weeks. Now, what are the risk factors for hepatitis C? These are exposure to toxic chemicals, unsafe sex, not being vaccinated, having an autoimmune disorder, unsafe drinking or washing water. Now, the transmission, how they transmitted. So here, sharing injectables, unprotected sex, and needle injury, mother to child transmission. The things which are not spread HCV are sneezing, coughing, hugging, kissing, sharing food or drink. This is the percentage view. Now, what is diagnosis? If patient have jaundice or clinical suspicion of acute viral hepatitis, we perform the liver function test, which includes the enzyme levels as AST and ALT. So if it comes in the normal range, so we confirm that there is no acute viral hepatitis. But if it is elevated, so we can say there is a possibility of viral hepatitis. We then after that we confirm it by different serological testings, and for HCV we do anti-HCV test. If it is positive, so there will be hepatitis C virus. Hepatitis C testing and diagnosis. As we have said earlier, liver function tests as AST and ALT levels are measured by this. So if we have increased level or elevated levels of it, so we say that there is possibility of liver disease. After that, we have anti-HCV antibodies. These are proteins your body makes when find for hepatitis C virus in your blood. These usually show up about 12 weeks after infection. Usually takes a few days to a week to get result. Though a rapid test is available in some places, the result can be positive or negative. If it is positive, it means that you have hepatitis C antibodies and you have been infected at some point. And if it is negative, it means that you have no hepatitis C virus. After that, we have a test HCV-RNA. It measures the number of viral RNA particles in blood. They show 1 to 2 weeks after infection. This can be positive or negative. If it is positive, it means that you have hepatitis C, and if negative, so you do not have. After that, we have biopsy to determine abnormal cells or cancer in liver. This is the diagnostic test for HCV infections versus serological tests, as we have EIA enzyme immunoassay, or we have RIBA recombinant immunoblot strip assay. These tests are very sensitive, or EIA is very sensitive for the HCV, but it indicates past or present infection but do not differentiate between acute, chronic, or resolved infections. And after that we have hepatitis C ribonucleic acid, or we can say HCV-RNA. It may be qualitative test or quantitative test. Qualitative test detects presence of circulating HCV-RNA, detects virus as early as 1 to 2 weeks after exposure. And quantitative, we determine concentration of HCV-RNA. It is less sensitive than qualitative. After that we have different treatment regimens for which we have used according to the patient conditions and duration. Also choose for the condition of and symptoms of patient. So we have different regimens we use according to condition. After that we have a slide which have shows contraindication about interferon alpha and ribavirin. Due to contraindications and many adverse effects of conventional uses of interferons and ribavirin, we have today's medications, which are the combination of 2 or more active drugs which will improve patient compliance and decrease frequency of administration. So in this topic we have first drug, Daclinsa, approved drug used for hepatitis C type 1 and 3. You can take this pill once a day, so it decreases also frequency. Now we have second drug, Merit, 3 pills daily, can treat all types of hepatitis C. After that we have a drug, Harvoni. It is also a combination drug. This once a day will launch a revolution in hepatitis C treatment, force interferon free medication for people with type 1. It is also used and effective for type 4, 5 and 6 also. After that we have drug Vicara. It is also used to treat type 1 with liver scarring, but when your liver is still working. So it takes 2 pills once and another day, twice a day. After that we have Sovaldi. These drugs are given together to treat HCV type 1. Before that you had to take the pills with interferon or ribavirin. This can treat all types of hepatitis C with a single tablet. After that we have VOCV. This can also treat all types of hepatitis C with 1 tablet that you can take each day. These are the foods which cleans your liver, include crab fruit, beet, carrots, cabbage, cauliflower, avocado, turmeric, etc. Now there is a case study which I have to explain. In this we have a man named RD, age 52 years. His hepatologist does not initiate interferon therapy. Now represent to the clinic with mild ascites and scleral icterus. Significant abort testings are shown. So what pharmacologic agents are effective in the treatment of patients with chronic hepatitis C? So what is subject? Age 52, gender male with mild ascites and scleral icterus. Now what is the object? It shows the normal results and the lab results of this patient, which shows that very elevated levels of bilirubin, ammonia, AST and ALT also have. After that we have assessment, which total bilirubin conjugated plus unconjugated. High levels of it indicates biliary obstruction, impaired liver function and hemolytic anemia. Serum ammonia indicates also liver diseases. AST, ALT levels also indicates liver disease and acute hepatitis. High levels of bilirubin, serum ammonia, AST, ALT suggest viral hepatitis, which is confirmed by hepatitis C virus antibody, RIBA, or it is confirmed type by hepatitis C virus ribonucleic acid. So what is the plan? After confirmation of hepatitis C, following regimen is given. Daily fructose combination of berry tapraware, 150 mg ritonavir, 100 mg ombitavir, 25 mg with dasabuvir, 600 mg as part of an extended release regimen, or plus twice daily dasabuvir 250 mg and weight-based ribavirin for 12 weeks daily, or we can give it daily semi-provir 150 mg plus sulfovir 400 mg for 12 weeks. Now these are the references, and thank you.